Common issues in pregnancy. Most women have a healthy and straightforward pregnancy with no major issues. However, even if you're having a healthy pregnancy, you may still have some issues. For some women, these are an inconvenience, while for others they can be more severe. You'll probably be able to manage many of these yourself. They should get better on their own or with help from your midwife, GP, or pharmacist. Every woman's experience is different. When to get medical help? Phone your local maternity unit or the NHS 24-111 service immediately. If you have bleeding from your vagina, have discharge from your vagina, such as watery, clear, or colored. Discharge have vision issues, such as blurred vision and flashing lights. Or a severe headache, have severely swollen hands, ankles, and face. Feeling sick or being sick, have constant pain in the upper part of your abdomen, have chest pain or breathing issues, feel very unwell. Think you've noticed changes in your baby's movements. These could be a sign of serious health issues for you or your baby. Backache. As your baby grows, there's more strain on your pelvis and spine. This can give you backache, which can get worse as your pregnancy progresses. Managing backaches. If you have backache, do some gentle exercises. Take care when you're lifting. Wear flat shoes or shoes with a low heel. Try sitting and standing with your back straight and shoulders relaxed. Bend your knees when lifting lighter things and ask someone else to lift heavy things for you. Morning sickness. Around 4 and 5, women feel sick or are sick, vomit, at some point in their pregnancy. Morning sickness usually starts between the 4th and 17th week, is at its worst around week 9, stops by the 20th week. Managing morning sickness. Sickness can normally be managed by taking care about what and when you eat and making sure you have plenty of fluids. You can get antacids from your pharmacist, or your GP can prescribe anti-sickness tablets if you need them. Severe symptoms may need to be managed by an obstetrician. Severe morning sickness. About 3 in 100 women get severe morning sickness. It can happen for different reasons, including sensitivity to changes in hormones, having a multiple pregnancy. Sometimes morning sickness can be so bad that you may not be able to keep any food or fluids down. If this happens, you may need to have fluids given via a drip in your arm, which may mean a stay in hospital. Constipation. Constipation is when your bowels don't move as often as usual. Your stools might be hard, lumpy, and unusually large or small. It can sometimes be uncomfortable or painful too. Changes to your hormones can cause constipation. Managing constipation. You can prevent it or ease the symptoms by eating high-fiber food such as vegetables, fruit, beans, and whole grain bread. Drinking at least 2 liters of water a day, being active, taking a walk every day, or swimming. Speaking to your midwife, pharmacist, or GP if these things aren't working. Constipation medicine is available and safe to use during pregnancy, which may help cystitis. Cystitis is an inflammation in your bladder. It's usually caused by an infection. Cystitis can cause a burning feeling when you urinate, make you feel you need to pass urine all the time. As your womb gets bigger, it causes pressure on your bladder and kidney, making it harder to empty your bladder completely. This can lead to urine infections, which can be more common when you're pregnant. If you're feeling uncomfortable, don't wait to see if it becomes an infection. Go to your GP. You may be given antibiotics to take. Heartburn. Heartburn or indigestion is a burning feeling around the middle part of the top of your chest, behind your breastbone. It's caused by stomach acid rising into the tube joining your mouth. You're more likely to get heartburn later in your pregnancy as your baby presses on your stomach. Managing heartburn. To ease the symptoms of heartburn, try to eat little and often and slowly take antacids for heartburn. But speak to your midwife or pharmacist for advice before taking anything. Heartburn can be made worse by drinking strong tea or coffee or pure fruit juice, eating spicy and fatty foods. Piles or hemorrhoids are swelling inside or around your anus, back passage. If the blood vessels inside the swellings are large, they can cause itching, a burning sensation, bleeding when you go to the toilet. They're common in later pregnancy and can get worse if you're constipated. Managing piles. Laxatives, ointments, and medicines can ease discomfort, pain, and bleeding. Your midwife, pharmacist, or GP can advise how to prevent and treat piles. Pelvic girdle pain. Pelvic girdle pain develops when the muscles, ligaments, and the small joint at the front of your pelvis stretch. This can cause a lot of pain in your pelvis and back. Around 1 in 5 pregnant women have pelvic girdle pain. Contact your local obstetric for advice. Swelling happens.